Thank you, Dr. Damania. My name is Dave Seymour. I've been working in the field for about 20 years, and I've been a therapist at Bakersfield College in the Student Health Center for about 6 years. And I've learned a lot since I've been working there, and one of the things is really understanding how childhood trauma affects people later in life. And it was really a kind of a breakthrough for me, and it came as the result of the experience that I've had, the education that I've had, and I've always been a little on the introspective side, so noticing things about myself that I see in clients, and sometimes the only difference is a matter of degree. I can usually see myself in most of my clients if I'm honest about myself, and so I learn a lot that way, and it helps me connect and identify with what my clients are talking about. So one of the most profound things that I've noticed is the percentage of people that I see who have been through childhood trauma. I'm going to talk about trauma in a general way, and then I'm going to talk more specifically about different kinds of trauma. But overwhelmingly, there is a parallel between what people struggle with in the present and the kind of things that they've been through in childhood. So an example, let me back up a second. I want to talk a little bit about the neurological reasons for this. You all know that the formative years are like birth to age 7 or sometimes birth to age 10 are considered the formative years. In that time, the brain is developing at a very rapid rate. People say that toddlers learn things like a sponge. That's literally true. And everything that a child experiences, the brain registers that experience. And so, what we need to develop successfully through the different stages of development are self-assuredness, internalizing the belief that we're lovable as people, as humans, and a sense of self-efficacy, that I can make it in the world. And when a child goes through trauma, especially if it's regular and consistent over an extended period of time, the brain registers that neurological connection on a deeper level, and the neurological connection into the emotional state that results from the trauma. So if a person is being physically abused throughout their childhood, they're being given a very clear message that they're not good enough. People tend not to really think too much about physical abuse, and people who experience physical abuse tend to believe that it was just discipline and that it was just part of growing up, and it's in the past and it doesn't affect them anymore. So that's what the introduction Dr. Damania read mentioned, that we don't usually understand how it affects people. And so the brain registers this neurological pathway. I make a mistake, I get yelled at, I get hit. Sometimes it happens when I don't make a mistake. Sometimes it's when a parent or a caregiver is just in a bad mood. And the resulting emotion is I'm a bad person. And there's fear, there's sadness, there's anger, a whole lot of negative stuff that the brain is experiencing and registering. So that happens on a regular basis. The neurological connection becomes very strong and a very deep connection. It's almost like a go-to emotional state that the person experiences. So fast forward 10, 15, 20 years, you have a college student who has been through this kind of stuff, and the results, the behavioral results, are really interesting. When we look at people who tend to have disciplinary problems, people who are oppositional defiant, people who tend to self-sabotage a lot, people who are underachieving because they're not able to achieve at the level that they're capable of. All of this can be traced back to childhood trauma, and I'm going to explain how, but in a very general sense, the person gets used to this result of being in trouble, of feeling shame, feeling guilt, being sneaky, trying to get away with things, to the point where it becomes almost an addictive quality to it. You hear about celebrities occasionally having strange behavioral problems or addictions. I remember hearing, I don't know if it's true or not, but Winona Ryder getting arrested for shoplifting makeup. Winona Ryder doesn't need to shoplift makeup, obviously, but there was something in her childhood that gave her the compulsion to do something that would potentially get her in trouble. If she didn't get in trouble, she still got that sort of fix of adrenaline or excitement, risk of doing something bad, quote unquote. And if she does get caught, then it replicates the experience of getting in trouble. That's the kind of stuff that we do in order for childhood experiences to keep playing themselves out. When I worked in a crisis unit a while back, I was seeing that the crises that people were getting themselves into or experiencing were very similar to what they experienced in childhood. There was a similar component. People who grew up with abuse tended to be in abusive relationships. People who grew up sexually abused tend to end up in relationships with people who have problems with pornography or relationship intimacy. So if you're looking at academic functioning and social functioning, something that I see very frequently is people procrastinating. Now, everybody pretty much has experienced frustration and struggles with procrastination because we all like to do preferred activities before non-preferred activities. But for some people, the pull to procrastination is a lot stronger than just wanting to do something or it just being about the thing that I have to do is that difficult or that miserable. Usually once we get into doing something, it can be enjoyable. It's the anticipation of it that cause people to avoid and procrastinate. So if you think about that, why would I do something that keeps me feeling stressed, miserable, that dark cloud hanging over my head, when I'm very capable of doing it, and doing it would make me feel better? I had to look at that question for a long time in my life, and I still struggle with that, but it kind of came to me just as the result of exploring that question and seeing it in clients that I work with, that overwhelmingly people who have experienced childhood trauma struggle a lot more with avoidance because self-esteem is lower, self-worth is lower, our sense of capability is lower, our sense of deserving success is lower, our feeling of anxiety is higher because we have this feeling that if I don't do it perfectly, I'm not good enough and I'm not going to be approved of, et cetera, et cetera, et cetera. So there's all of these emotional states that children internalize as the result of emotional, physical, and sexual abuse. There's other kinds of traumas that happen that are more accidental kinds of things. Those don't tend to be registered as deeply and affect a person's functioning. Those kinds of things typically are gotten over with time. But when somebody is given the message that they're not good enough for the people who are supposed to love them the most all through childhood, that does a number on a person's ability to be successful in life. So you have people that there's always people students who become well known kind of infamously for getting into trouble, stirring up things, complaining about things. And what they're doing is reenacting what they've been through in childhood. If somebody is expressing conflict with a teacher. Maybe it starts out as disagreement over something the teacher says. They express that disagreement, the teacher maybe corrects them or doesn't, and then it turns into kind of a battle of I know more than you. That student probably grew up with a parent who was constantly correcting them, giving them the message that they don't know enough or they're not good enough. So that person feels that, so they feel victimized by that. They have been victimized by that in a genuine way, but they tend to feel that all through life. But not only do they feel that, they also have the potential to act out what the perpetrator was doing because they also experience that. So we learn from watching other people. That's Albert Bandura's social learning theory, is the fact that we learn by imitation. So in addition to being victimized, we're also at risk of replicating the same behaviors that our abuser used or demonstrated. So a common thing that I see is a student that does very well all through childhood, high school. They're doing well in college. They've been through a lot of stuff, but they overcame it and they're able to function on a very high level. That person learned that they needed to function on a high level at some point. A lot of times it's the firstborn Latino female who has to take care of younger siblings, so they learn how to be functional, but still have all of this feeling like I'm not good enough because parents were coming home saying, why didn't you do this, 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 and this? And the person has been working their butt off all day and not being recognized for it. That's a pretty common experience. So I saw one young woman who did very well all through school, and she got to one particular class and she couldn't pass it. She tried, she gave it everything she had, she put a lot of time into it, she went to tutoring, she studied a lot, she learned the material, but when she went in to take the exam, she had so much anxiety that she couldn't recall the information that she knew. This is a very common thing. When the emotional part of the brain is activated with anxiety, stress, whatever, it overrides the frontal cortex of the brain, and the person literally can't retrieve information that they genuinely knew the night before. The reason that emotional experience is so strong is because there came to be so much riding on passing this exam and passing this class that it brought up that level of anxiety. It was so important. It was important for self-acceptance, for moving on into the program they were in, all of that stuff. So I asked this person flat out, because there were so many markers that indicated sexual abuse. I asked her if she had been sexually abused. She said no, not to her recollection. When I experience this, I usually inform the person that it's likely that you went through something that you may not have recognized as abuse, or you may have forgotten, because young children, the only defense mechanism they have is dissociation, is for the consciousness to literally check out so they don't experience the intense emotional pain that they're about to experience. So when dissociation becomes a regularly used defense mechanism, people dissociate in adulthood, but they don't really see it happening. Some people do, but a lot of times it happens on a low-grade level, just like zoning out. So for a lot of students, when they're in lecture and there's nothing really stimulating them in a way that's interesting to them, they tend to get fidgety, and dissociation can happen because in that state of boredom, emotions are coming to the surface because there's nothing distracting them from those default emotions coming to the surface. And rather than, recognize it, acknowledge it, put it aside, and stay focused, they start to feel anxious and they don't know why. Sometimes it leads to a panic attack, but usually the person just kind of goes off into daydreaming. And so they don't learn the material, they're not really present for it. That's a very common experience. So I think it was about this 7th session with this person where I had asked her, if anything had come up that she remembered, and she said, okay, I need to break this down. What do you need to report? When do you need to report? What kind of situation? Because she didn't want to tell me anything that was going to get anybody reported, at least at this time. So it turns out that the person who was sexually abusing her is still living in the home. And the situation is either she moves out or she lives in the home. But the other person moving out of the home was not an option. So this gave me something to work with because I knew that that was a source of this person's anxiety. This person internalized a very deep sense of shame and guilt, and when she wasn't able to pass that class and it threatened her livelihood, it triggered that level of shame and guilt that there's kind of a threshold for people who repress traumatic emotions. So people are usually pretty successful at repressing things until their own emotions related to something in the present get to a certain level, and then it's kind of like the floodgates are opened and all of that emotion comes to the surface. And that's why people end up having panic attacks and they don't even know what triggered the panic attack. Somewhere there was an association in their environment to something they experienced in the past. There was no consciousness or understanding that this was happening. Sometimes it's a smell, sometimes it's a way somebody talks, could be anything. So this person was able to, over time, process what she had been through. And it was a pretty difficult situation, but this is what most people who are struggling are dealing with something like this. The people that tend to struggle enough that they make it to therapy, and I'm not sure, there's definitely gender differences. Part of the gender differences is because girls or women are more likely to disclose sexual abuse than boys or men. And this is typically because there's more shame involved for boys or men. A lot of times the perpetrator was the same sex, so it causes a lot of confusion and the person just doesn't want to deal with that. But of the women that I've seen since I've been at BC, of the people that I know because they reported sexual abuse, at least 75%. And then there's probably 10% more that probably experienced stuff, but they were so young that they don't remember it. This isn't uncommon because when people are really young, they don't have the cognitive structure to kind of place this kind of incident. And so they typically just check out and are likely to not remember it. The typical earliest ages that people remember are about 4 to 5 years old. The most frequent times is about 5 to 9. And then usually people start experiencing a lot of emotional problems in junior high because they're going through puberty and they're having sexual feelings, they're having relationships, they're trying to win approval, they're looking for approval in gangs, things like that. So all of this shame, guilt, anger, it forces people to act in ways that reenact their childhood, and it's a very strong correlation. So my role at Bakersfield College is a mental health provider in the Student Health Center. I'm also part of the Students of Concern committee, and we meet weekly and talk about students that are having ongoing difficulty, or maybe there was an incident. And then I will, if it's a mental health related issue, they will be referred to one of the therapists. Or if it's a particular need that the student has, they might meet with some of the social worker interns in the Office of Student Life. But the students that tend to get in trouble a lot are, I can say across the board with 95% accuracy, are students that either have a neurological deficit that they were born with, or they experienced childhood trauma, mostly in the form of abuse. People that underachieve, people that are more capable than what they achieve at for mental health reasons, those are the students who in younger years could have been placed in special ed as severely emotionally disturbed, and sometimes they do. But usually they squeak through with some disciplinary actions that have taken place because of ways that they've gotten in trouble. But those are the kinds of things. So the common scenario is a person who experiences sexual abuse or molestation. Most commonly, it's an older extended family member, like an uncle, an aunt, or an older cousin, male or female. Both genders, it's not equal, but it does occur in both genders. So that person has been opened to an experience that they're not emotionally ready for. And people say that a lot, but what does that mean, not emotionally ready? It means that they feel a whole lot of guilt because they've been told all their childhood, don't let anybody do this, and don't you do this. And when an older relative does something, a child tends to believe it's okay. It's almost like that person is sanctioning that activity even though it's not a healthy activity. So the person experiences this whole new world, and they start wanting to experience adult experiences, literally. It kind of opens the door to wanting to experience adult entertainment, and suddenly 8, 9, 10-year-old typical activities don't quite do it anymore. And they want to be experiencing these high intensity, using drugs, engaging in sexual relationships. That's one of the first questions I ask is, when was your first relationship? When was your first sexual encounter? Have you been sexually abused, or did you experience any sexual activity in childhood? Because it doesn't take coerced or forced sexual abuse for a child to internalize a lot of shame and guilt. What people have typically called same-age exploration, sexual exploration, I believe causes a lot of guilt in a child, and if it becomes a regular thing, can be a source of anxiety, shame, and guilt in that person's life later on. So a common thing is for the person to start acting out with sex and drugs and exciting kinds of activity, which in turn bring on more shame and guilt. The person may believe that as long as they don't get caught, it's not going to have any negative ramification. But what the person is internalizing is, I'm going to put myself on the line to see if I can get away with this exciting behavior. And it's not just about getting caught and other people shaming that person. It's that they're internalizing the act of being sneaky and getting away with something, and people later on in life become kind of addicted to that kind of behavior. So depending on what happened, what the circumstances were around the abuse, whatever the person took in tends to get replayed later in life. In the relationships that we have, by the level of success that the person achieves or is not able to achieve, and the way that a person feels about themselves. So in relationships, people start gravitating towards people who will accept anybody if they've been through a lot of shaming experiences. They don't believe that they're going to fit in with people who function on a high level. So the misfits tend to gravitate towards each other. And that's not necessarily a bad thing, because people find these sort of subcultures as a way of fitting in and experiencing belongingness, but the activities that they're typically engaging in or being exposed to oftentimes replicate the same kinds of stuff. So people often find themselves in relationships or friendships with people who may be emotionally abusive, verbally abusive, sexually abusive, etc. So that's kind of the social ramification. In addition, people tend to be hypervigilant about other people judging them or being critical towards them. If a person has grown up with judgment and criticism and high expectations, they tend to believe that the whole world is looking at them that way. And so when they feel something isn't quite right in a friendship, they start kind of freaking out, wondering, what did the person mean by this? And they start putting layers of judgment and criticism on things that aren't necessarily there. And so they respond in turn with, what they believe is righteous indignation or anger or whatever, and the relationship goes back and forth with conflict. This is pretty frequent. When people become suicidal and tend to engage in self-injurious behaviors, is because that level of shame and guilt is so deep that when they feel rejection in a relationship, whether it's an intimate relationship or a friendship, it tends to be experienced as exponentially bigger than what it really is. So it's activating that person's, all of those negative beliefs of, I'm not good enough, I don't belong, nobody loves me, should I even be alive, the world would be better off without me. That's almost always the result of severe experience of rejection. And usually rejection by the person that the person is most dependent on. So if it's a teenage child, it's usually their mom, or if they're in a relationship, they tend to make that person their everything. So when you start feeling rejected or criticized by the person that you care about the most, the effect becomes very profound, to the point where a person will cut on themselves. And the most common reason people cite for that is because it distracts me from the emotional pain. I believe that's true, but I think the reason it distracts people from the emotional pain is because it's kind of a feeling of self-punishment. So the person feels like, if I punish myself in a way that nobody else could possibly ever punish me, maybe people will realize that I take this seriously and I feel bad about this, and they won't be so hard on me. Maybe they won't reject me if I'm taking responsibility by punishing myself. I believe that's kind of what it comes down to. I've seen enough people that this correlates with very strongly that I can say pretty consistently that that's what happens. For most people who struggle with suicidality, sexual abuse is usually in their history. Verbal abuse and even physical abuse don't typically cause the level of shame and guilt that sexual abuse does. It's taboo, it doesn't get talked about. If it happens by a same-sex person, the person questions their sexuality. There's just a lot of complicated stuff that goes on with it. Another interesting thing that I think is a pretty profound impact is when a person experiences sexual abuse, they're experiencing a very intense, pleasurable physical sensation And different people experience it different ways. So for some people, they say there was nothing pleasurable about it in any way. Some people say, yes, the physical part of it was pleasurable. And for some people, it becomes like a relationship. It happens so frequently, it becomes like a secret relationship. And when that happens, they're carrying that shame and guilt 24/7, waiting for somebody to find out. And if nobody finds out, it never gets processed and never goes away. So that's when you're pairing shame and guilt on that level of intensity with a physically pleasurable sensation or even emotionally pleasurable at some point, you're setting yourself up to not be able to experience pleasure or have a pleasurable experience of guilt and shame. And so you're reinforcing guilt and shame when it's paired with a pleasurable experience. And you're reinforcing self-sabotage when pleasure is tainted with the association of shame and guilt. So you see people who feel guilty about taking care of themselves because they feel like they should take care of everybody else before themselves. They don't believe they deserve to feel like they can take care of themselves. They don't believe that they can put time, invested time into themselves. And this is what the person truly struggles with, is not investing in themselves. They look at responsibility and things that will get them to where they want to go as these things that are unbearably difficult, unbearably boring, unbearably anxiety-provoking, and that's where the anxiety kicks in. And so that state is a need for the person to experience. They think that what they have to do is so difficult that they just can't get themselves to do it. The reality is they are so used to feeling that dark cloud hanging over their head that they have lived their life out in a way that replicates that feeling and continues to do that. And people go their whole life never figuring that out and believing that they don't deserve to feel good, literally, and so they don't. Most of the time when I talk about sexual abuse in a session, the person tells me, I've told 4 different therapists and none of them wanted to explore that because they said what's important is to go forward and not get stuck in the past. Or they've seen multiple different therapists and none of them have asked about sexual abuse. A lot of therapists believe that if a person doesn't bring it up on their own, then it shouldn't be brought up. I don't believe that by any means because people have no clue that this is even happening. They don't understand how that stuff is affecting them in the present. And when I break it down, it's like you see the light go off in their head and all of a sudden this weight is lifted off their shoulder. Like now they can believe that it really wasn't their fault. A person can hear that umpteen million times but not really feel like it because they don't understand why it's not their fault. They think I could have told somebody, I could have walked away, I could have fought the person off. Whatever the belief is, a child should not be expected to know how to respond to something like that. No matter how much we say, don't let somebody touch you, in your private place, a child shouldn't be responsible for setting that boundary ever. And so that's not their fault. The ensuing behavior that they engaged in after it happened is not their fault. A child shouldn't be responsible for managing compulsive sexual behaviors or compulsive avoidant behaviors or compulsive drug use, any of that kind of stuff. So the person typically goes through life experiencing shame and guilt and recreating that shame and guilt and believing that they're a bad person, lazy, all of that kind of stuff that society labels people like that with. So it's always a relief for a person to hear this. I've never had a person fall apart because a memory of childhood abuse came to the surface as the result of a therapist asking them if they've ever been abused. I've never had that happen. One time, as I was processing some of that feeling, the person started having a panic attack, and I walked them through the panic attack. But in the profession, we're so afraid of triggering a feeling in our client that's going to make them fall apart, like they've been holding it together successfully up until then anyway, which they haven't been doing. But it's always, always, always a relief for this to be recognized in a person who has experienced abuse. For it to be broken down, just like I'm breaking it down right now, because a person wants to know why they can't stop procrastinating, why they can't do things that they're capable of doing. If you're Christian, one of the biggest questions in Scripture is when Paul says, why is it that I don't do what I would do and I do what I wouldn't do? That's a question for all of us. Why don't I do the things that I really want to do? It's not because the other crap is so pleasurable. There may be a quick fix involved, and that tends to reinforce those activities. But it's really recreating that state of guilt and me doing the wrong thing. That's a lot of people are really stuck in that place. So it's important to understand this, whether you're a disciplinarian, whether you're an instructor, the things that make people act in ways that get them caught in life, get them in a place where they're struggling, is really not a choice. When I hear somebody say, you chose to do this, this was your choice, it's really dumping more shame onto that person, because when it's the result of a lifetime of shame and guilt that started in their childhood, it really isn't it is their responsibility, but it's not really a choice. Yes, every adult is only responsible for themselves. Well, let me reframe that. Only I can be responsible for myself as an adult. Same with every other adult. You can talk to your parents or whoever may have abused you. They're probably not going to change, and they probably won't get it. And it's probably not going to get you very far. It's important to feel the sadness and the anger, because that tells you that it was wrong, but you can't go back and fix it, and you usually can't fix the person in the present. So they have to just let it go and make the best of what they have. But when people are able to let go of that layer of shame and guilt, everything just becomes easier. It's like, it's not the result of them trying and trying and trying, and then one day they try hard enough and they break through. It's the result of the shame and guilt is gone, so I'm not recreating it anymore, and everything just becomes easier. So it's important for instructors, deans, everybody to understand that this is what the person is struggling with.